Welcome everyone. Today we are diving into the fascinating world of cranial nerves. These 12 nerves they control some of the most vital functions in the body, from smelling a fresh coffee to smiling, speaking, and even balancing on one foot. Understanding these roles is not just an academic, it is an essential part of diagnosing a range of medical conditions. Let's break it down nerve by nerve and build toward applying the knowledge to real life cases. An overview of the cranial nerves. Let's start with this, okay? So we are talking about classifications of cranial nerves. There are sensory, motor, or both, okay? So these cranial nerves can be sensory, where the nerve helps to experience the world through sight, smell, and taste. They also can be motor nerves that control movements like eye movements and facial expressions. Some of them they have both functions, so sensory and motor at the same time, or in other words, they are multitaskers. We will explore each of these nerve function and test that in details, and to keep in mind that these nerves they play a very essential role in the body. Going through the nerves names, we have 12 cranial nerves as we mentioned. So these nerves are number one is the olfactory nerve, two is the optic nerve, three is oculomotor nerve, four is the trochlear nerve, five is the abducens nerve, seven is the facial nerve, and then vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, and accessory nerve, and finally the hypoglossal nerve. The olfactory nerve is your sense of smell. It, to test it, you can ask the patient to identify scents like coffee or vanilla. And a fun fact about it is something that we call anosmia, which is a loss of sense of smell. It can be an early sign of neurodegenerative disease like Alzheimer's or Parkinson's disease. Think of it as the nose's way of sending an SOS about the brain's health. The optic nerve handles vision. When testing it, use a Snellen chart for the sharpness and the peripheral vision test. Here is a real-life case. A patient comes to the clinic with blurred vision and reduced visual fields. He turned out to be having optic neuritis, which is often linked to multiple sclerosis. This shows us how crucial is the optic nerve in the early diagnosis of systemic diseases. The oculomotor nerve, or cranial nerve number 3. It controls most of the eye movements and pupil constriction. Testing include checking the papillary light reflex and eye movements in an edge pattern. A classic condition linked to this nerve is a third nerve palsy, where patient may present with a droopy eyelid and a down and out gaze. This could be an indication for a serious condition like an aneurysm, so act fast. Next is the trochlear nerve. Trochlear nerve controls the superior oblique muscle, which lets you look down and in. Picture this: a patient complains of double vision, especially when reading or going downstairs. They might have a trochlear nerve palsy, and testing involves asking the patient to follow your finger towards their nose. It's a small nerve, but it makes a big difference in daily life. And then the abducens nerve. Abducens nerve controls lateral eye movement, and the common issue is a sixth nerve palsy, where a patient's eye may stuck in a crossed position, causing double vision to the patient. Ask the patient to follow your finger horizontally. If they cannot, this might be a sign, an indicator that there is a pressure on the nerve from an increased intracranial pressure or even a brain tumor. Now we'll talk about the trigeminal nerve. Okay, the trigeminal nerve is the largest cranial nerve. It handles the facial sensation and chewing. Imagine the patient with sharp electric shock-like pain in the face, and this is a hollow mark for the trigeminal neuralgia. Testing this nerve includes assessing the sensation with a cotton ball and evaluating the chewing muscles. A fun fact is trigeminal neuralgia is sometimes called the suicidal disease or the suicide disease because of its intensity. However, modern treatment offers some help. And now let's talk about the facial nerve. Okay, the facial nerve is responsible for our facial expressions and also for the taste. Let's talk about Bell's palsy. A 40 years old patient wakes up with a droopy face and can't close their eye. It's an alarming sign, but Bell's palsy is often treatable with steroids. Testing includes checking the facial symmetry by asking the patient to smile, raise the eyebrows, and also by testing the taste on the tongue. Next comes the vestibulocochlear nerve or cranial nerve number 8. This is the nerve responsible for managing hearing and balance. And the classic test for that is Rumberg test for balance and also testing hearing by the tuning fork. Now let's talk about the glossopharyngeal nerve. It is the nerve that handles the taste at the back of your tongue and the swallowing. Ask the patient to say ah and or check the movement of the uvula. A weak gag reflex or swallowing difficulty might be a sign of glossopharyngeal issue. Example is when a patient that goes through a neck surgery has some damage during the insertion of the uh, intubation. And then the vagus nerve, which is the nerve that is called or named as the jack of all the trades. It controls the voice, the throat, and the organs in the chest and abdomen. And you can imagine how important is this nerve as it controls most of the organs in the body. And comes next the accessory nerve or the cranial nerve number 11. This nerve controls the shoulder and the neck movement, which is very important. And testing this involves asking the patient to shrug the shoulders and to turn the head against resistance. You can picture recovering from neck surgery would struggle to move the shoulder. This can be an indication of possible accessory nerve injury. Physiotherapy can be helpful at this point. Last but not least, the cranial nerve number 12, the hypoglossal nerve. This nerve is responsible for controlling the tongue movement. To test that, ask the patient to stick their tongue out. Any deviation to one side can be an indication of some weakness. For example, when a patient has a stroke, the patient will suffer from slurred speech. This will be an indication of some hypoglossal nerve involvement. The speech pathology can be helpful at this point, so speech rehabilitation can be recommended. Now let's put the knowledge to test in a case scenario. So we have a 55 years old male or patient that comes with dropping face, trouble closing one eye, and loss of taste in the front of the tongue. And the question here is, which cranial nerve do you suspect is affected? Is it the trigeminal, facial, glossopharyngeal, or hypoglossal? I'll give you 1 minute to think about it. Next question is, which function aligns with these symptoms? Chewing and facial sensation, eye movement and pupil reflex, facial expression and taste on the tongue, and finally balance and hearing. And finally, or the last question is, how would you test this cranial nerve? If you guess the cranial nerve correct, you will know. Is it the taste of gag reflex, or to shine a light and check pupil constriction, or to ask the patient to smile and raise their eyebrows, or to perform a hearing test? Here's the answers. So if you guessed the facial nerve or cranial nerve number 7, you are correct. Testing involves facial movement like smiling and raising the eyebrows. These symptoms align with the nerve's motor function and the sensory roles. Real-life case is Bell's palsy or Lyme's disease and often present in this way. Diagnosis cranial nerves is like a detective work to observe, test, and connect the dots. To sum up, cranial nerves may be small, but their impact is really numerous. Understanding them help us to diagnose and treat conditions that affect our senses, movements, and overall quality of life. Thank you for joining me, and remember, when it comes to cranial nerves, every detail counts.